So today's question is, what is the difference between a psychiatrist, psychologist, and therapist? I get asked this question quite regularly, actually. So the thing all three have in common is that all of them are mental health professionals. But in order to understand the difference between them, I suppose we should start by briefly explaining what a psychiatrist is. So a psychiatrist is, by definition, a medical doctor who specializes in mental health conditions. So they have a medical degree, and then they go on to specialize in mental health. And their field of expertise is differentiating mental health conditions from underlying physical health conditions that could manifest with psychiatric symptoms. So, as a medical doctor, a psychiatrist is licensed to prescribe medications for the mental health conditions which can be treated effectively with drugs. Now, when therapy is required in combination with that medication, a psychiatrist may also provide psychotherapy or counseling, although they tend to refer patients to psychologists or therapists instead. But many do work as therapists, especially in the United States. Not so much in the UK and Europe, but definitely in the United States they do. A psychologist, on the other hand, is someone who holds a doctoral degree in psychology. Now, that's either a PhD, which is a research doctorate, or a PsyD, which is a professional doctorate. So, psychologists study the human mind and human behavior. And within mental health, they specialize in diagnosing mental health conditions. Of course, psychologists are also qualified to offer counseling and psychotherapy and to perform psychological testing and design and provide treatment plans for mental health conditions. But whereas a psychiatrist is a medical doctor, a psychologist is an academic doctor. So psychologists don't write prescriptions. Having said that, most psychologists do tend to keep up to date on drug treatments and pharmaceutical advancements. And this, I suppose, is because it's important that they understand what the psychiatrist is prescribing for their patients and for their clients. But psychologists focus on human behavior. And because of this, not all of them work in mental health. So some are educational psychologists. Then there are criminal and forensic psychologists who work in law enforcement and for the prison service. There's occupational, workplace, and consumer psychologists who work in the corporate sector. And of course, clinical psychologists. And these are the ones who work in mental health, and I suppose are the ones that most people are most familiar with. And finally, a therapist or a mental health counselor, they or a psychotherapist, and they provide therapy, pretty much like psychologists do. And whilst I suppose all psychologists could be therapists in theory, not all therapists are psychologists. So therapists who aren't considered psychologists generally have either a bachelor's degree or a master's degree in psychology, but don't have a doctorate. Whereas psychologists tend to focus their energies on diagnosis and research, researching mental health disorders. In addition to providing therapy, the scope of a therapist's work is primarily and almost exclusively focused on working with clients in a counseling and therapeutic capacity. So I hope that goes some way in explaining the differences. I, I get it. It can be a complicated thing when you're not in the industry, and because some psychologists will call themselves therapists, and some psychiatrists will call themselves therapists, and some therapists and counselors will call themselves therapists. So yeah, it can be confusing. I get that. But anyway, hopefully that explains it a little bit better for you.